I'm here with James Cavuoto, and I'm so excited to talk with you because you've been in this space for a very long time, and that means that you are expert level.
That means I'm a really old guy, but I appreciate your comment.
But there's so many people that are really just now coming into the neurotech space, and so you started NeurotechReports. Tell me a little bit about what made you decide to start it, especially then, and how much it's grown throughout the years.
Yeah, thank you for the question. We started in 2001, to be more specific, September 2001, which, by the way, is probably the worst time you can possibly imagine to start a business. It was right after 9/11. And the early days of the neurotechnology industry, it was pretty sparse. We almost gave up and threw in the towel, but I was convinced that there's going to be a lot of potential in neurotechnology. Even though there wasn't a lot of commercial activity, there wasn't a lot of government funding or private investment, there was one public company, Medtronic, and a few startups, but I really believe that patients have the need, the technology had great potential, and that given time and given more awareness, that this industry was going to blossom. And in fact, over the last 24 years, it's done exactly that.
And you've been helping with the awareness as well.
Well, I appreciate your compliment. Maybe we've had a small part, but yeah, we've worked with startups in the industry, not just through our publication, but we produce an annual conference called the NeuroTech Leaders Forum. Just had our 24th annual event in San Francisco, and it's an opportunity for startup neurotech plans to interact with larger firms, with VC investors, with government agencies, or maybe to find researchers from universities who could be helpful in developing a new generation of therapy. So, we like to think that we've created, an opportunity for people to interact within the industry.
And when you're at an event like this, a neurotech event at CES, I'm assuming it's giving you some hope as well, because you're seeing your vision and where you thought it would go, and you're seeing people coming together now and really talking about it and diving into it.
It's exciting for me to be here at CES because before I started NeuroTechReports in 2001, I was actually in the computer industry as the editor of a publication involved with electronic publishing, and used to go to a lot of industry events. You may recall the Comdex event, which was a precursor, a big computer industry event. And so after a couple of decades, it's kind of fun to be back here, kind of in the reach where I began, and see the interaction of consumer technology with neurotech. And many of the speakers and companies that we saw during today's session here, the MODA session, just a testament to the potential there is in evolving consumer technologies.
What did you see today that you're so interested in? Things ideas or companies that you can't stop thinking about?
Yeah, there's several really exciting areas of neurotechnology. It's really hard to pick one or two, but from today's session, there were several speakers on the subject of brain-computer interface. A brain-computer interface is exciting because it ties together computers and consumer devices with the brain, right? And there's opportunities there for people who are suffering from a number of diseases and disorders, including spinal cord injury, including ALS, or including disorders where they don't really have a way of interacting with the outside world except a brain-computer interface. So that's exciting in its own right. But down the road, the potential for ECIs as a consumer device is a way to really enhance and accelerate the human-computer interaction. And we're just beginning to scratch the surface on applications there. So that's one. The other area that I think is really ripe for growth is psychiatric applications, and we heard from Jacob Robinson today. He's the founder of a company called Motif. Very promising firm developing a minimally invasive brain implant. And one of a few firms who are interested in finding solutions to people suffering from psychiatric disorders, major depression, schizophrenia, anxiety disorder. There are a number of different NeuroTech therapies that are useful for psychiatric disorders, as well as pharmaceutical approaches. But as we know, with pharmaceutical approaches, there's a large percentage of the population, 30 to 40 to 50% of the, say, depressed community, that doesn't respond well to pharmaceuticals, to antidepressant medications, either because the side effects are terrible or because it just doesn't work. And so people like Jacob Robinson and others are developing alternative therapies for psychiatric disorders. So these are a couple of things that we saw today that I think are really promising.
There's so many people, too, that are just hearing about this for the first time. But here we are at a NeuroTech event, and what are you hoping this looks like a year from now, 5 years from now in the neurotech space?
Yeah, I really have to compliment the Motive people because they've done a good job of, reaching out to the consumer electronics world writ large to say, hey, look, this is an area of technology that's got really good application, and we're going to develop, we're going to grow hand in hand as the new, advances in electronics and microelectronics capabilities, and as we gain more knowledge in neuroscience and how the brain works, right? These two advances are going to go hand in hand and offer opportunities for new therapies, but also opportunities for enhancing, the lifestyle of consumers, whether they're suffering from a neurological disorder or not. So I think an event like this has the promise of stimulating growth, building awareness, hopefully building the investment appetite of investors, building the appetite for partnership, and really growing the industry.
I want to go back to 2001 when you first started, because you saw something that a lot of people weren't seeing. But what was it that led you to say, okay, the career I've got going, the thing I'm doing right now, I need to pivot and do this other thing? What was it personally for you?
Yeah, so from a personal standpoint, I was a biomedical engineering student many years ago. You can tell by the gray hairs. And the field was very new. There wasn't much demand at the time when I graduated for biomedical engineering, which is how I ended up in the computer industry. And but in 2001, which was right after the dot-com crash, not many people may remember that, but it was a pretty significant event in the computer industry. And it was frustrating for me to see all of the investment that had gone into dot-com. Some of it good, but a lot of it was, maybe speculative. And yet to see fields like neurotech where you had people who really had a need for solving a problem. Jennifer French is a good example. She was one of the speakers today. One of the first people I got to meet in 2001 before we launched NeurotechReports was the opportunity to meet with Jennifer. Jennifer had been paralyzed in a snowboarding accident. She told the story today in her talk, and she was convinced that she was not going to have to spend the rest of her life in a wheelchair. She was going to look for a clinical trial that she could participate in. And she found a trial at Case Western Reserve University, which is my alma mater. And in fact, it was a device invented by one of my professors at Case. And she was the first woman to be implanted with a functional electrical stimulation system. She talked about it today and has demonstrated in the past how she can stand up out of her wheelchair using her own paralyzed muscles. When I saw that in 2001, It was dramatic. It was exciting. The talk that she gave was just so inspiring, and it made me feel like, wow, all the money that's gone into .coms and, people who want their dog food delivered by the internet. Okay, sure, that's a good market, but people who are handicapped, people who need a solution to a problem or experience, they're not going to change their minds, right? They're going to continue to have that need. It's going to be a need that needs to be addressed. And guess what? It's taken a while, but now today we see not one, not two, but a handful of companies who are not just developing, but marketing solutions for people who are paralyzed by spinal cord injury. Solutions that get them up out of the wheelchair. These different approaches. Jen's approach using functional electrical stimulation is just one. There's people using neurorobotic systems, right? There's people who are using what's called epidural stimulation. It's a method of stimulating the spinal cord directly and combining that with physical rehabilitation to restore function to paralyzed people who were told you will never walk again. Well, guess what? They're walking and they're using their hands. We saw today an amputee who was fitted with a prosthetic arm that restored the ability to grasp things, to turn a key, to feed themselves. These are just wonderful examples of what the technology can offer. Jen mentioned a cochlear implant, restoring hearing. Hundreds of thousands of deaf people who could not hear can hear again, right? There's preliminary work going on in visual neuroprosthetics, restoring at least some vision to blind people. We're not nearly where we, would like to be, but, you're not going to get there overnight. It's going to take baby steps, and a number of research institutions and commercial firms develop therapies that help restore some vision to blind people. So those are things that get me excited and get me, motivated to keep going.
Was today almost a full circle day for you?
Yeah, in a way. It was.
I can see that. And it's so important too because you had the vision and now you're seeing a lot of things come to fruition. But what I want to know is what you're hoping and maybe another full circle moment for you would be an ideal. Because you're on a mission. So what would the yes, this is it, this is why I did all this.
And maybe it's next year or maybe it's 5 years down the road and maybe it's here at CES or maybe it's some other event, but where we see neurotechnology more seamlessly integrated with our lives, right? Where it can be a tool for those who have neurological disabilities, a disease, Alzheimer's disease or ALS, and it's restoring function. But it's also a tool for those of us who may not have a neurological disease, and it's helping us interact with a computer or with another device, an automobile, an airplane, a microwave oven, and it's making us more productive by, kind of reducing that barrier between what we're thinking, what our intentions are, and what our actions are, right? That gap between intention and actions. And that's something that we all can benefit from.
You're inspiring me. We could talk forever. But is there anything you'd like to add or anything maybe that I didn't even think to ask?
Oh, golly, there's probably a million things, but a couple of things that came up today during the Motive event are talking about some of the risks, and there are risks involving brain data, right? So Errol Garten mentioned this. Actually, it was also Ken Lee, who is one of the pioneers in the area of consumer EEG sensing devices, right? Who owns that? Who owns that brain data? Well, the user should. We should all own our own brain data. And yeah, you can incentivize the user to share their data, just like focus groups or advertisers can incentivize a user to participate, right? But it's important to recognize that our brain data belongs to us. And so that was a theme that I think was touched upon today by a number of speakers, and is definitely worth considering.
Thank you so much, James. I really appreciate it.
Thank you. I enjoyed
for sharing your knowledge, your insights, and your vision.
Appreciate it.